The playbook also outlines the communications the employers required to do once you've got a confirmed case. So there's two groups of people you have to communicate with. You've got to communicate with your local health department to advise of the positive case, and it's the health department where the employee resides. And then secondly, you've got to notify your workforce, those employees who have potentially been exposed to the virus through this employee who has been a confirmed case. And the playbook, actually, the way it's outlined, you could probably copy and paste that and use it in a check form basis. They've got it in somewhat columns, and you can. I'd suggest just taking that, copying it, and having it ready to go in the event that you've got a confirmed case. So when you contact the local health department, be sure to ask them for all the guidance they can give you on what's the next step you need to do. Work with them. Ask them how frequently they expect you to give updates on newly identified cases and any symptomatic workers. You're going to want to share a list, a roster of all your workers in with the local health department in the jurisdiction where the workplace is located, and any guidance they give you, any specific protocols that they have published or that they communicate with you, you've got to make sure that you follow all of those items. So now when you're communicating at all times, whoever you communicate with about a positive case, the law requires that you maintain the confidentiality of that person's medical information. Do not disclose their names. Do not disclose information that someone might use to identify who the employee is. And in notifying the other workers who are potentially exposed to the person with the confirmed case, it's a best practice to do that, though it can be done verbally as well. And the playbook also discusses it gives potential suggested language for the written notification, and also acknowledges that you can further communicate orally with them. The employees that you have to notify are those who came in close contact with the confirmed case. And that means those who spent 15 minutes or more within 6 feet of the individual with the confirmed case. So that potentially could be an awful lot of your employees. And as Mike had mentioned already, in advance of having a confirmed case or an outbreak, have your contingency plan set up. How are you going to identify these persons who may have come in close contact? And then you want to give them the instructions on what they should be doing to protect themselves, and also for them to self-monitor. In a good source to direct employees to is the CDC guidelines itself. You can give them a handout with that, circulate it via email, whatever is the most convenient for you to do so. But there's a lot of resources which the employer can use in communicating the training for the workforce. You can use employment records to verify who was working, what shifts, what area, what department, what location. We had one client who had even used the cameras to see who this person actually came in contact with. So you should use all the resources you can to best identify those workers who may have been exposed and notify them. Those employees should self-quarantine for 14 days. That's the standards. There's some leeway if you're an essential operator like restaurants are, but the practice is to just employ quarantine. There's an exception to that. You can consult with your attorney. Um, so the next topic that we're going to go to is pretty significant, and it kind of flew under the radar, and it only happened recently on July 17th. The CDC modified and changed its guidelines on how to determine when to stop home isolation. And the first significant change is that the CDC is no longer recommending testing to determine when someone should return to work. Um, there is a caveat to that. If a doctor is recommending that the employee be tested, then the doctor's advice should be followed, and the doctor should be advising the employee when he or she can return to work on test results. And another exception to the no testing guide is any persons who have a severe COVID-19 case or who have a weakened immune system. They may need to stay home longer. They may need to be tested. They may need to contact an infectious disease doctor, and they should be following the advice from their doctor. The other modifications that the CDC just made is that they've changed their symptom-based strategies, and that's there on the screen. If we could move to the next slide, please. So the California playbook that we're focusing on today has now adopted all of the CDC modifications. And in the playbook, when it discussed the timeline for when employees can return to work, it's front and center, caps in bold, follow the CD guidelines, always follow the CD guidelines. And what I've done here is I've summarized the CDC modifications. So now it's no longer test-based, and the CDC is saying it's only in rare circumstances that a test is required to determine if someone should return to work. So now the criteria that you're going to be focusing on is a symptom-based criteria. If depending on the category of how your employee is categorized, whether they have symptoms or they don't have symptoms, or if they've tested positive, or if they've just been in close contact with someone who has been positive, uh, there's different time requirements. So what to do when the employee has had symptoms, and this is going to encompass an employee who has symptoms and has been tested and was found positive or negative, or even an employee with symptoms who has not been tested. And here are the three items. Number one, 10 days since the symptoms first appeared. And number two, there's been 24 hours with no fever without the use of fever reducing medications, and the COVID-19 symptoms have improved. So if they meet those three criteria, whether when they've got symptoms, whether they're tested or not tested, whether they're positive or negative, this is the guidance that they're now able to return to work. If the next slide, please. So the next category of employees that we're looking at is if you've got an employee who's asymptomatic and has tested positive. The requirements for the return to work is that the employee continues to remain symptom-free and that 10 days have passed since he or she was tested for the virus. If during the quarantine period the employee develops symptoms, then you have to go back and follow the guidance from the prior screen. Now, those employees who don't have a confirmed case or who haven't been tested one way or the other, and even if they don't have symptoms, if they have come in contact with someone with COVID-19, whether in the workplace, out in the community, or in their home, The guidance is that they need to stay at home for 14 days after their last exposure to that person. Now, it seems odd that someone who has no symptoms, who even who could have had a test and it said that they were negative, they have to stay quarantined for 14 days when someone who's tested positive, and as long as they don't have symptoms or a fever, can return in 10 days. That does appear to be a conflict, and the CDC acknowledges that, but they have placed the guidelines in place regardless of the 14 days, based on the time that it could take to develop the infection. If we could move on to the next slide, please. And lastly, the CDC has also provided this overall guidance that anyone who has had close contact with someone with the virus and who then developed the illness within the last 3 months and has recovered and remains without COVID-19 symptoms can come into work. I've placed here at the bottom of the slide the link to the CDC website that goes through these new modified timeline tables for determining when an employee returned to work. And if we can move on to the next slide. This slide is the timeline for returning to work as it's outlined in the California Playbook. And what's outlined in the Playbook is totally consistent with the new guidelines by the CDC. It's just set up in a little bit different format. We can move on to the next slide. So they categorized it into 5 categories. Here we're at the second category. Now we've moved on fourth category, but these are all essentially a summary of the modifications to the CDC guidelines. And there is a potential exception for essential workers, but I would err on the side of caution and be conservative when you've got an asymptomatic, untested employee who's been in contact with someone who has a confirmed cases. If it's really going to disrupt your business operations, then there is some justification in these guidelines that the employee does not need to stay at home and self-quarantine. You've got to be vigilant and diligent about, confirming symptom checks with that employee, making sure, wearing the proper PPE. But again, the local health department may allow an exception to this if it is going to severely impact your operations. And if at any time that asymptomatic employees who are self-quarantined during this 14-day time period develop symptoms, they need to contact a healthcare provider, and they should be contacting the employer as well.